Think about it. Our sense of smell has helped humans survive for thousands of years. It alerts us to danger, like spoiled food or smoke from a fire. But what if your nose could also detect danger inside your body? Research shows that some types of cancer can produce unique odors that people don't notice, or worse, ignore. In this video, I'm going to walk you through 8 specific smells that your body might give off if cancer is present. These aren't the obvious signs we usually hear about. These are subtle and often ignored smells, but recognizing them could be life-saving. Make sure to stay until the very end because this information could make all the difference. Let's get started. First, let's discuss the link between smells and cancer. Did you know that cancer can affect the body in ways that are often subtle and surprising? Changes in metabolism from certain cancers produce unique chemical compounds that alter body odor, breath, and sweat, though most people may not detect these changes. Studies have identified volatile compounds released by the body in response to certain cancers, including lung cancer, skin cancer, and bladder cancer. Researchers observed that trained dogs can sniff these changes with remarkable accuracy. In fact, they've successfully identified tumors in their early stages, even before medical tests could detect them. And it's not only dogs contributing to the fight against cancer. Science is advancing too. Researchers are developing devices that mimic this incredible ability by analyzing the chemical compounds the body releases. These technologies have the potential to transform early cancer detection in the future. But until these tools become widely accessible, paying attention to persistent, unexplained odors could be an early warning sign, helping catch potential issues before it's too late. 1. Sweet odor. Lung cancer is one of the most silent and dangerous forms of the disease. It can progress quietly for a long time without any noticeable symptoms. However, in some cases, there's a surprising clue, a distinct scent. People with lung cancer have reported a sweet, slightly fruity odor on their breath, which could be an early warning sign. This smell is the result of volatile organic compounds being released in the lungs. These compounds, produced by the altered metabolism of cancer cells, build up and become noticeable in a person's breath. While it may resemble the smell of fermented or rotting fruit, it is different from typical bad breath. It doesn't go away with regular oral hygiene, and, more importantly, it tends to linger over time. Sadly, it can be overlooked for months, as it's often mistaken for other issues like digestive problems or diabetes. That's why it's crucial to stay alert. If this smell persists without a clear explanation, it should not be ignored. Lung cancer often comes with additional symptoms that, when paired with the unusual odor, should raise concern. These include a persistent cough, shortness of breath, hoarseness, and chest pain. If you notice any of these signs, it's crucial to consult a doctor immediately. While lung cancer is one of the deadliest forms of the disease, it also has high treatment success rates when caught early. 2. Metallic odor. A metallic odor is another unexpected warning of a serious illness, blood cancer. Individuals with leukemia or lymphoma often notice a metallic smell coming from their breath or sweat. It occurs due to changes in iron levels and other chemical compounds in the blood, triggered when cancer cells disrupt the normal production or breakdown of healthy cells. This smell is often compared to the scent of rusty metal or old coins and is most noticeable during excessive sweating or following light physical activity. The main issue with this symptom is that it's subjective and doesn't cause immediate discomfort, making it easy to overlook. Most people dismiss the odor, attributing it to environmental factors, diet, or hygiene, without realizing it could be a serious warning sign of an underlying health problem. In addition to a metallic odor, leukemia and lymphoma can cause extreme fatigue, persistent fever, frequent infections, and unexplained weight loss. If this unusual smell is accompanied by any of these signs, it's crucial to seek medical attention immediately. These cancers can progress rapidly, but early diagnosis greatly improves the chances of successful treatment. 3. Smell of ammonia. Kidney cancer is a serious disease that often progresses without noticeable symptoms. However, one unusual warning sign the body may give is a strong, pungent ammonia-like odor in urine. This occurs when the kidneys, responsible for filtering blood and removing toxins, start to fail due to the impact of cancer on their normal function. The ammonia-like odor is caused by the buildup of chemical byproducts in the body, such as urea. However, it's important to note that not all cases of this odor point to cancer. Urinary tract infections, severe dehydration, or high-protein diets can also alter urine odor. But if the smell is persistent and paired with other symptoms, it's crucial to seek medical evaluation. Common signs of kidney cancer include back pain, blood in the urine, extreme fatigue, and unexplained weight loss. When these symptoms occur alongside a strong ammonia smell, they should never be ignored. 4. Sulfur in breath. Gastric cancer is a sneaky disease that often presents with vague symptoms that are difficult to detect. However, one of the most noticeable signs may be on your breath, the smell of sulfur or rotten eggs. This smell is caused by poor digestion, leading to the release of sulfur gases in the digestive system. When cancer affects the stomach, it disrupts normal food processing, producing volatile compounds that create this distinct odor. Bad breath linked to gastric cancer tends to be persistent and doesn't improve with better oral hygiene or dietary changes. It's often mistaken for common digestive issues like acid reflux or gastritis, but its ongoing nature should raise concern. Along with bad breath, gastric cancer may cause other symptoms that signal the need for medical attention. These include abdominal pain, constant feeling of fullness, loss of appetite, frequent nausea, and, in more advanced stages, the presence of blood in the stool or vomit. Gastric cancer is often diagnosed late due to symptoms resembling common, mild conditions. A subtle sulfur-like breath odor can be an early sign. If persistent bad breath accompanies digestive issues, consult a gastroenterologist. Early detection boosts treatment success. 5. Smell of rotten meat. Skin cancer, particularly melanoma, is one of the most dangerous forms of cancer and can present in various ways. Surprisingly, an unusual smell can be one of its signs. Individuals with advanced skin cancer often notice an odor similar to rotting flesh or decay. This unpleasant scent is caused by the necrosis of cancer cells, which release volatile chemical compounds as they break down. The smell of rotting meat can appear in open wounds or skin lesions that fail to heal. This warning sign is frequently missed due to the location of the lesions, which might appear in hard-to-see areas like the back or scalp. Additionally, the smell is often misattributed to hygiene issues, common infections, or reactions to cosmetic products, delaying proper diagnosis. Changes in the color, size, or texture of spots and moles, especially if they darken, grow quickly, or bleed, require immediate medical attention. If these signs are paired with a rotting meat-like odor, seek a diagnosis urgently. 6. The odor of decomposition. Colorectal cancer ranks among the top causes of cancer-related deaths worldwide. Yet its early symptoms are frequently overlooked or mistaken for typical digestive issues. One such warning sign is a noticeable change in stool odor, which may become significantly stronger, more persistent, and take on a scent resembling decomposition. This unusual odor develops because colorectal cancer disrupts the digestive process, leading to the production of toxins and gases that alter the natural smell of stool. These changes may be linked to incomplete digestion or a buildup of toxic substances in the intestines. While it's normal for stool odor to change due to diet or medication, a recurring unexplained smell resembling decomposition should raise concern. This unusual odor may be accompanied by other alarming symptoms, including blood in the stool, ongoing abdominal pain, changes in bowel habits, and unexplained weight loss. If you notice these, along with persistent odor, see a doctor promptly. 7. The smell of mold or rotting wood. Mouth or throat cancer is a serious condition that can be difficult to detect in its early stages. One unexpected and rarely discussed symptom is a distinct odor, often compared to mold or rotting wood. This smell results from various factors, including secondary infections, tissue decay, and the release of volatile compounds from growing tumors in the mouth or throat. These compounds build up, producing the distinct odor, which is often noticeable on a person's breath. Unfortunately, this smell is commonly mistaken for poor oral hygiene or dental issues, which can delay seeking proper medical attention. The musty odor is often accompanied by other significant symptoms, such as persistent hoarseness, difficulty swallowing, mouth or throat sores that won't heal, white or red patches inside the mouth, and even unexplained ear pain. If a musty odor accompanies these symptoms, it's crucial to seek medical attention promptly. 8. Unexplained fishy smell. A persistent fishy smell, particularly from the vaginal area, is one of those odors that's often overlooked or dismissed as a minor issue. However, it can sometimes signal something more serious, such as cervical or ovarian cancer. These cancers can cause changes in the body's metabolic processes, leading to the release of specific volatile compounds that produce this distinct smell. While fishy odors are commonly associated with bacterial infections, like bacterial vaginosis, what sets cancer-related odors apart is their persistence. If the smell doesn't go away with proper hygiene or treatment for an infection, it's worth investigating further. This odor may also be accompanied by other symptoms such as unusual discharge, pelvic pain, irregular bleeding, or discomfort during intercourse. It's important to note that a fishy smell isn't always a sign of cancer. Most of the time, it can be attributed to less serious conditions. However, if the odor is persistent and doesn't respond to typical treatments, it's essential to see a doctor for further evaluation. Now, I know today's topic was a bit heavy, but these are conversations we need to have. Your body has an incredible way of communicating when something isn't right, and sometimes it speaks in ways we don't expect. Like we always say, when it comes to your health, it's better to be safe than sorry. If you've noticed any of these smells or changes in your body, don't ignore them. Make that doctor's appointment, get things checked out, and stay proactive about your health. And hey, if you found this video helpful, make sure to hit that like button and subscribe for more life-saving tips and health advice. Also, click the bell icon so you don't miss any of our future videos. We're here to keep you informed and healthy. Until next time, take care of yourself, listen to your body, and remember, your health is your most valuable asset. Stay safe, stay healthy, and I'll see you in the next video.